Well, today we'd like to tell you about Heartscore and the developments of Heartscore. Heartscore is the ESC's interactive electronic system of estimating the risk of cardiovascular disease. And the story starts with the fact that in most people, cardiovascular risk is the result of a number of interacting risk factors. This led us to develop a paper chart system of assessing cardiovascular risk called SCORE, based on 200,000 people from 12 European countries. It seemed to be natural, though, to develop an electronic version, and this is what we have called Heartscore, which is available to you through heartscore.org or through escardio.org. We've developed certain new features for this version of Heartscore, and this includes the addition of HDL cholesterol, the calculation of what's called risk age, and a very simple version which is based only on age, gender, smoking, height and weight to use body mass index to estimate risk. Heartscore exists in several versions. The usual version is performed online, but it can also be downloaded, and there are versions for high-risk parts of Europe and for low-risk parts of Europe. And in addition, we've made a number, 15 country-specific versions, the most recent of which is the French version. So for today's demonstration, then, we will use the generic high-risk chart, and all one has to do is enter a patient's name, which we'll do at the moment, and then their date of birth, which we'll put in as January 1955, and their gender, and then save it, and then we can go straight on and estimate their risk in an interactive manner. So for this patient, let's enter, say, a blood pressure of 160, and a cholesterol of 6.6. They're female, and we'll make them a smoker. And we can straight away calculate the risk by just pressing the Estimate Calculate Risk button. This will show us a table with the person's risk and what their risk would be if their risk factor control was perfect. Now let's go back and see what effect entering HDL cholesterol has. So same patient, same risk factors, but a low HDL at 0.7. Now we calculate the risk, and we get a figure, a higher estimate of risk. And we're now in what's called the patient information sheet. This can be printed out for the patient. So as we scroll down, we'll see graphic information. There's the patient's risk in the red on the left and what it would approach if they achieve perfect risk factor control. If we go down a little bit further, there's a pie chart on the risk, and which shows that a very big contribution here is smoking. Just above that, you'll see risk age. And you'll see that this lady has what's called a risk age of 74 years. In other words, her risk is the same as a 74-year-old lady who had no risk factors. So they can actually get younger, if you like, by reducing their risk factors to go back to her real age. Below this, there's personalized advice for the person about their smoking, about their blood pressure, about their cholesterol, all of which can be printed out for the patient. Now, if we scroll back up, we'll see the other main feature of Heartscore, which is that it also allows the doctor to interact with the current joint European guidelines on the prevention of cardiovascular disease. So this helps the physician remember how to advise about smoking, about the blood pressure guidelines, about the cholesterol guidelines. It also has a function of relative risk. So in a young person whose absolute risk might be quite low, if they've got a lot of risk factors, their risk may still be 10 or 12 times higher than it need to be. So to summarize then, this is the new interactive version of Heartscore. The new features are HDL cholesterol is included, risk age is estimated, and there's a simpler version, which we're not demonstrating today, based on body mass index.